This is the time of year that the NCAA basketball tournament, also known as March Madness, captures our attention. But at the same time, another kind of March Madness is affecting thousands of high school students as they await the decision letters on which college they will attend. In preparation for this, students and parents have weighed numerous factors to decide how to prioritize which college they want to go to, including the university's reputation, its curriculum, the quality of the faculty, tuition costs, the campus environment, social life, and even the caliber of the sports teams. This decision is truly a momentous one because it will indelibly influence their future, both professionally and personally. Now, as a psychiatrist, I'm struck by the fact that little to no attention is paid in the vetting process of the school's quality of health services, and specifically mental health services, an oversight that could mean the difference between success or derailment of a student's college education. The promise of college years is a period of youthful fulfillment, character formation, and educational enrichment belies the risk of being derailed by emotional trauma and mental illness while they're at school. This is because the ages when they attend college coincides with the onset of many mental disorders. In fact, youth is the sweet spot for the onset of most mental illnesses. In addition, young people are going to face new challenges and stressors when they go to college. For many, it'll be the first time they're away from home and the watchful eyes of their parents. And today's college experience includes many pressures: academic, peer, the temptation for recreational drug and alcohol use, and having greater sexual freedom. These pose a veritable landmine of risks for psychological disturbance at a vulnerable time of their life. And the data corroborates this. Mental health disturbances in youth are rising. According to a Healthy Minds study, which collected data from 373 campuses nationwide in the past school year, over 60% of the college students surveyed experienced at least one serious mental health problem. In addition, over 30% of matriculating students starting college are already taking psychotropic medications, and more will have psychotropic medications administered in the course of their college years. In my career, I've seen many young patients whose education and lives were affected by the onset of mental illness that was not adequately treated while they were in college. Among the worst cases are those of first episodes of psychotic disorders like schizophrenia, which can result in outcomes of lifelong disability and psychotic symptoms, or even worse, suicide and violence. More commonly, students suffer from depression and anxiety, which in some cases can impel them to self-medicate with recreational drugs, or even engage in self-harmful behaviors. Now, despite this rising tide of mental health problems among students, universities have not fully embraced the responsibility of upping the quality and the extent of their mental health services. Most provide a limited number of counseling sessions and then referral to outside providers of uncertain quality if more care is needed, and they don't provide any systematic follow-up to this. Their inaction is mostly due to uncertainty. College administrators and trustees are uncertain whether to take this on as a responsibility because there's no revenue stream and there's added liability. Now, given this disappointing reality, parents and students would be well advised to inform themselves about what resources are available at universities should the need arise for mental health while their child is at school. Now, here is a quick list of questions that you can ask to inform yourself about this. Now, if you find that such services are available, this will give you greater peace of mind. But if not, you should be prepared to take matters into your own hands in arranging for the necessary mental health care for your kid should the need arise. To be forewarned is to be forearmed. So until the next time, this has been Dr. Jeffrey Lieberman for Shrink Speak with another Shrink Short.